Couple of things.
We just can't win right now.
That's why we should be inside.
I'm just going to power through. Situational awareness on COVID-19 in the community, an update on how you can get tested, because that's been a major concern of a lot of people, very understandably. What you should do when you get tested positive, and then an update on CDC guidelines around quarantine and isolation, which Director Bond's going to talk about. And in particular, I think a lot of the interest today is going to be about the testing, the governor's work providing municipalities around the state with a lot of rapid tests, self-tests. So first, situational awareness. As everyone has been watching, the COVID-19 numbers are just skyrocketing right now. We're experiencing the biggest surge the state has seen since the beginning of the pandemic. Yesterday, the governor announced a daily positivity rate of nearly 11%, and today it is almost 15%, 14.98% positivity rate, 963 hospitalizations. Yale New Haven Hospital, their numbers right now, ICU is at 83% of capacity. Wanted to underscore that the majority of people that are in the hospital with COVID are unvaccinated. We say that again and again and again. If you're unvaccinated, it's much, much more likely that you are going to the hospital and could potentially die. 75% of COVID patients in the hospital, Yale New Haven Health System, are unvaccinated. Another study found that 85% of hospitalizations between June and September were among unvaccinated individuals. A larger share of vaccinated hospitalizations are the folks who are 65 or older and have underlying chronic conditions such as hypertension or diabetes. Also important to note that vaccinated people who end up in the hospital are less likely to be on a ventilator. They're less likely to develop viral pneumonia, and they have shorter hospital stays. Get vaccinated. Get boosted. I can't emphasize that enough. I have some personal friends that have not gotten vaccinated, and I try very hard to convince them that given the percentage of cases out there right now, which I am certain is above 15%, because there's a lot of self-testing at home that is not reported into our system, COVID is everywhere. Get vaccinated and get boosted. Testing. So I've been getting text messages, emails, a lot of concerned people that are having trouble identifying testing. The surge in testing that started before the holidays is a combination of people that are interested in going to see relatives, see friends, and want to get tested proactively, which is really responsible to do. I appreciate the folks doing that. And then also the significant rise in cases. It is totally overwhelming, the testing system. The hospital was totally maxed out with their appointments. And we've been hit hard as well with our partnership with the state and Wren Laboratories. Wren is still able to accept appointments and walk-ups. So one option for folks still is the saliva-based testing that is in the morning at 60 Sergeant Drive and in the afternoon on the New Haven Green. We encourage people to get appointments beforehand, but they can also walk up. It's just a much, much longer wait. And the times, people should check on our website for the exact times on that. At-home rapid tests, we're seeing the president releasing a lot of these in the communities across the nation, but there's going to be a time delay on us receiving those. The governor's team was able to identify and acquire 3 million tests for the state of Connecticut. And we anticipate that on Thursday, those tests will be available for New Haven. New Haven is getting 15,000 test kits. Each test kit has 2 tests in them, so there will be a total of 30,000 tests available for New Haven residents, correct?
We'll actually have 30,000 kits, so that's actually...
We have double. We have 30,000 kits. That's great news. We have 30,000 kits, so that's 60,000 tests. 60,000 tests, and we anticipate receiving those Thursday. We are planning on distributing them in 2 ways to the community. First is to nonprofits throughout the community, that some of our community partners that work with vulnerable populations, individuals experiencing homelessness, for example. And the second is we are going to be doing 2 mass distributions to New Haven residents. One of those will be on Friday, one of those will be on Saturday. We are working out the details and are not yet ready to release the locations and the logistics around those, but people can anticipate on Friday and on Saturday that there will be 2 separate mass distributions of rapid home tests. We're encouraging people that are going to be going back to work and potentially expose other people, or families that have children that are going to be going back to school on Monday, to get these rapid tests and have whoever is the individual or individuals that are going to be interacting with other people to get those tests. Want to underscore that if you're not going to be in an environment where you're going to be exposing other people and you're not symptomatic, there's a limited number of tests. Even though that's a lot of tests that we're going to be receiving, we still have a limited number of tests. So people that are going to be exposed, whether it's your students, your children going back to school or at work, we're encouraging you to pick up those test kits. In addition, the state is providing N95 masks, non-medical N95 masks to the community as well. I've started using a KN95 mask because they give a lot more protection, and masks, there's overwhelming evidence that indicates that they keep you safe and keep other people safe. And we will be distributing those as well throughout the community to our nonprofit partners that work with vulnerable populations and at this mass distribution event. Want to remind people we have a mask mandate in the city of New Haven. If you're in a public space that is indoors, you are required to wear a mask. We continue to enforce. Director Bond and her team are out and about enforcing. I want to switch to schools. Dr. Tracy and I have been in close communication about keeping schools open and keeping kids in school. There's a number of very important reasons for that. The social, emotional support that a school provides, the educational experience is more significant and better in schools. It's also a huge pressure on families and caregivers if we close schools. Our goal is to not close schools. We anticipate this is going to be a tough several weeks. I don't think anyone thinks otherwise. We anticipate that there are going to be significant numbers of cases, and our plan, working closely with Director Bond and her health team, is to work case by case, classroom by classroom, to identify whether we need to close a classroom and quarantine a classroom. Potentially, if there's a lot of cases throughout a grade, close a grade. But we do not intend to close schools, and we will work very hard not to do that while keeping folks safe. We want parents and families to be ready for remote learning, because if your entire class is quarantined, the teacher will be doing remote learning. That is why parents throughout, since September, have the children bringing their devices back and forth from school to home. My daughter, every day, we put her tablet in her backpack, charged and ready to go. She goes to school with her tablet, she comes home with her tablet. Parents need to be prepared that on the moment's notice, they may need to go switch to remote learning. Again, we're going to work very hard not to do that, but we also need to be real about the situation. I think that's all I'm going to cover for now. I'm going to hand it over to Director Bond and then Rick. Go ahead.
Thank you. So good afternoon. So as the mayor provided a update on where we are with our situational awareness, it is safe to say that we are officially in a community-wide spread where we are anticipating 1 out of 4 people are positive for COVID. Predominantly, the variant that is leading with this pandemic is the Omicron virus, and so we're asking individuals to remain home if you're sick, get tested if you have access to testing, but making sure that we are now going to transition to the new CDC recommendations. As you know, yesterday there was a lot of coverage that CDC provided new isolation and quarantine recommendations. What does isolation mean? Isolation means that you tested positive for COVID and you need to remain home, isolated from other people in your home. Quarantine means that you've been exposed to COVID and you need to monitor your symptoms, get your temperature checks, and get tested after day 5. So we went from a 10-day quarantine recommendation to a 5-day recommendation. So if anyone, regardless of vaccination status, needs to stay home for 5 days if you test positive, we will likely recommend that you get tested with a rapid test or a PCR test, which is the gold standard if accessible, and then be able to resume activities if you are no longer experiencing symptoms but must wear a mask for the additional 5 days, whether indoor or outdoors. So we want to stress that factor that if you are positive, remain home for 5 days. If your symptoms subside, you are able to return to normal activities or try to remain home for the remainder of the duration of time. For those that are vaccinated and boosted, if you have been exposed and you have access to testing, we do recommend that you get tested after 5 days. What do these recommendations for CDC mean to us as a city? What that means for us at the workplace is that we will be revising our protocols for our workforce so that we can ensure that they adhere to the new recommendations. And so those recommendations will be put forth to Human Resources Department to distribute to our department heads within the city and our public safety leaders. And so we want to make sure that we are now complying with the new CDC recommendations. We know that science has shown the shedding of this disease is lessened for those that are vaccinated and boosted, and this particular variant in general. We are also working closely with the Emergency Operations Center, Rick Fontana, who's behind me, on distributing the rapid test kits. And so I will have Rick give some further details on that matter so that we can be able to answer any questions that you may have.
Good afternoon. Thank you, Director Bond, Mayor Elicker, and Josue, our new emergency response coordinator. Welcome aboard. These are extraordinary circumstances we're faced here. You know, I think we're at war with a pandemic, and in order to combat the pandemic, we need to get people tested. We know we've had a huge backlog of those individuals who are tested. It's usually taking 24 to 48 hours. We've seen a little bit of that extended due to the holiday and due to the amount of tests. In 2 days alone, the city of New Haven, we had 2,000 COVID tests at our Wren locations. That is at 60 Sargent and over here at the New Haven Green. As the mayor alluded to, we will be receiving 30,000 eye health self-test kits. We will have those, they'll be on the ground literally coming from the federal government. They'll be on the ground here in the state tomorrow. They'll be unpackaged, and we will have them as soon as Thursday, getting them to our partners, getting them out to the public. You know, this is a strategy that we have to do this. We don't want any on our shelves here. Everything we get, we're going to give out. We'll also have N95 masks, non-medical grade, individually wrapped. We'll be getting those out to the public as well. And again, this is a really extraordinary time, and some of the offense that we have to go on is getting these folks test kits and masks. In our partnership with the state of Connecticut, Department of Public Health, and the Emergency Operations Center at the state level, and our regional partners, they want us to have as much as we can to take care of our residents. So we're going to continue over, again, on Friday. We'll continue into the weekend. This is the first of more than one shipment. We will have more. And as soon as we get them, we'll be doing a point of distribution in a couple of areas around the city to make sure that residents have those kits. Can't find them anywhere else. They're difficult to get off of a shelf. You can order them, but we want people to have them as quickly as possible so they can test. If they are positive, hopefully stay home and not pass the spread. Thank you. Question?
So this is now separate from what we're getting from President Biden.
Yeah.
Either of you.
So you want me to answer that? You want me to say So this supply is coming from the state, and there's going to be different tiers of distribution of rapid test kits. So we are going to be getting this directly from the state of Connecticut. The federally qualified health centers will be getting another tier directly from the federal government, and then K through 12 will be getting another shipment in the upcoming weeks. And so we're very fortunate that we will be having supplies tomorrow. We know that the supplies are limited, but what's good news is that there's different levels of shipments happening from different capacities of federal and state levels. And so we will be working closely with our partners and making sure that we're thinking through, as the mayor mentioned, our local partners that deal with vulnerable groups so that they have access to rapid testing. And then also, most importantly, our children and youth so that they can be able to remain in school and have quick and rapid results. Any other questions? Okay. All right.
Great, thanks.
You know
Heather.
where the distributions that are gonna take place later in the week are likely to be?
So we will have a press announcement tomorrow and more details to come regarding where and how we're going to be distributing the rapid and the rapid test and the mask.
I do have another question with that. I don't know if it's gonna announce tomorrow, but what are there stipulations to people who can access the COVID test and the mask?
So that's a good question. So there's a couple of things that we're doing. The main criteria is being a resident of the city of New Haven. That is the only eligibility criteria. So we just need some level of proof that you are a resident of New Haven. Every single town in Connecticut will be having their own supply. So we want to encourage residents to contact your local municipality or town to be able to get access to your own rapid test kit and mask within your respective city and town. So for us, we're prioritizing city residents so that we can make sure that there is equity around our distribution, including those that are within our target service areas of partners. I wanted to also mention, since we're talking about mass distribution and rapid test kits, one of the things that's so vital is that we're going to be doing an education campaign where we're going to be informing the public of how to do a rapid test and then also when to take a rapid test. So that video series is a combination of what iHealth was already promoting. We have translated the voiceover into Spanish to making sure that it's also bilingual so that we can be able to supply that to those that are have language barriers of English in Spanish. And so we want to make sure that that's available. And so an educational handout form will be distributed with the rapid test kits when we issue them.
Just one more question,
Yes, Mark.
because I spent the morning talking to some suburban fire chiefs and first select folks, and all of whom seem to be working off the same list, and they all talked about how they're not getting enough for all the residents, and it's going to be first come, first served. And the list has New Haven listed as getting, I think it's 16,000 kits, so that's about maybe 17,000 kits, about 34,000 tests. How did you guys manage to get more than that?
So you want to mention it? Or
Yeah.
You want to mention it? Or
Yeah.
you want me to? Okay, go ahead.
So we the initial there was some change in numbers. So the initial number of kits was approximately 16,000, and again based on going through the numbers of what they had as a shipment, what they were expecting, they were able to increase those numbers. And again, by all means, it's all based on population. So when you look at all of the communities throughout the state, throughout each of the regions, it's all based on population. So our numbers, of course, are going to be much higher than most of the other suburban areas because of the population. Is it enough? It's not enough, but it's a start. And we were told this is the initial shipment, and there are more to come. So we'll be anxious to get more, but again, this is a great start for our people to at least get test kits into people's hands.
Mark, just to be clear, they weren't concerned about New Haven getting too much, right?
Was that?
They didn't.
No, nobody.
It was just.
Well, I didn't know that you were getting something other than what was on the list until
Yeah.
I came here.
Yeah. So there's an algorithm that's set
So does
when
that
we're
mean everybody's getting more than they think they're getting?
Yes.
Okay.
yeah, and that is all based on an algorithm, and then those are issued per city, per town. So there's an equal distribution based on the population size. And that's sort of the mechanism that's used for many other factors when responding to things such as this pandemic. All right. Thank you, everyone.
Thanks, everybody.